Welcome to a COVID-19 HR Hotline question and answer session. Your presenters are Lori Greenlees, Director of HR Hotline, and Linnell Meath, Director, HR and Content Strategy.
Some of the questions we've been receiving on the HR hotline are related to employer designation of paid leave related to the Families First Act. So one of the first questions I wanted to ask Lori was, can intermittent emergency paid sick leave and emergency FMLA be allowed for partial days? So let's say there's a full-time employee that's working remote 4 hours a day, but then needs to assist her children with schoolwork since the school is closed for the remainder of her day. Is that allowed for partial days?
Yes, so the Department of Labor has clarified that intermittent benefits are allowed if the employer agrees and the employee is able to work. And that's true in certain situations, this example being one of them where it's a situation where the school is closed. So when you have an employee who's working partial days remote, for example, here we have an employee who maybe is working 7 to 11 in the morning, works 4 hours, and then they're logging off to spend time with their children and help them with their schoolwork throughout the day. In that situation, the employee would get paid her wages for the 4 hours that she's working, and then she would be eligible for 4 hours of benefits under the Families First Act of 2/3 of her wages, capped at that limit of $200 per day. If the intermittent schedule does not work for the employer can deny the intermittent request and have the employee take consecutive leave. So for example, if this employee says, I'm only able to work from 7 in the morning until 11 in the morning, and that's just not a schedule that's conducive to the employer can deny it and say, unfortunately, we're not able to accommodate that work schedule, and have that person take consecutive leave.
And I think that's a really great point to emphasize, is that there needs to be that agreement, right, between the employee and the employer. So if the employee says, well, I can work this, the employer has to evaluate whether that meets their needs in terms of getting the work done. And I think really the big emphasis too is that try to be flexible, try to be accommodating. These are what we've heard a million times, unprecedented times, right? So I think that is a really good point to make, that the employee and the employer should work together. I guess the other thing that comes to mind to me as well when you talk about partial days is kind of that, can they work remote or not, and what's the reason? So the employers really need to pick that apart, because think about it in this scenario. If the employee is sick or caring for someone who is sick, but says, oh, I can still work a couple days on site. Well, for those reasons, it cannot be partial days. Employers cannot allow that, obviously, because we're trying to minimize the risk of spread. So it's really a really great question to pick apart in terms of how to do intermittent. So it's a really great call that we get on the hotline, because we can talk through all the different scenarios and ensure the employer is making a good decision.
Right, good point.
So then the next question is, what if there's an employee that was diagnosed with COVID-19 and they've exhausted their 80 hours of emergency paid sick leave benefits? If that person cannot return to work at the time, should the employer designate additional time off, potentially under traditional FMLA?
And the answer to that question is maybe. If the employee is eligible for traditional FMLA and their situation qualifies as a serious health condition, then yes. So HR practitioners should fall back on what they've always known as it relates to traditional FMLA. Does it meet one of the FMLA's definition of serious health condition? So for example, is the person involved or seeking inpatient care, meaning they've been admitted to a hospital? That would be a situation that qualifies for traditional FMLA. Another example could be is whether a person has had more than one appointments or follow-up appointments with a healthcare provider, so they're rising to that level of continuing care and treatment. from a healthcare provider. So that could be a second situation if they have a period of incapacity of greater than 3 days. So again, it's falling back on those traditional FMLA. If an employee, has had the virus and they haven't had complications, again, some employees or individuals, what they're experiencing from a health standpoint can look very different. The CDC has said some people experience some minor issues, kind of similar to the common cold or flu. Those employees may not be covered by traditional FMLA. But on the other hand, if you have an employee who has experienced complications, is hospitalized, those would qualify for FMLA. So you need to look at it on a case-by-case basis.
Perfect. So then the last question is about an employee who is experiencing symptoms of COVID-19. They've sought medical treatment, missed 2 weeks of work while waiting for that diagnosis, and then it turns out that the test is negative. So does an employer need to pay the employee those emergency paid sick leave benefits in that situation?
Sure. So in that situation, most likely, yes. There's 6 reasons that qualify for the emergency paid sick leave benefits. And under reason number 3, the Department of Labor has clarified that if a person has taken the test, sought medical treatment, and they're awaiting those test results, that time is covered by the emergency paid sick leave benefits. However, again, depending on how the employee is feeling and if they have mild symptoms, if they're able to work remote and they're feeling up to it during that time frame, another option for that employer would be to have the employee work remotely while they're awaiting those test results. So if they're feeling well enough to do that and remote work is an option, that could be another option instead of taking the emergency paid sick leave benefits.
Yeah, that's good to point out, and I think that also brings up the whole, stay in communication with this employee, keep that going, so you kind of know what's transpiring on their end, and the employer then is well aware of the situation. Great.
Right.
So it's these kinds of questions and others that we're receiving on the hotline and from employers, and we have a variety of things available for employers to tap into, whether it's documents or other resources to help them through this, whether it's online training to help with their leaders and managers during this time, or whether it's actually bringing someone to help support from an HR standpoint who can either help transition through some of the things that we're going through right now. So keep in mind that there's different levels of help that MRA can provide, and we are here for you. In addition, our HR hotline is available 24/7, and the contact information is there on the slide. Thank you so much.